This presentation is going to focus more on standard medical treatment of addiction, particularly in the realm of opioids. The second part, which you can access later, will include more of the body, mind, spirit approach. These are important items to include in any time that you're assessing substance use. You can do this a number of ways. There are different questionnaires and instruments that I'll talk about in just a moment. But if you choose to just discuss this as a verbal question and answer session, it gives you time to develop a personal rapport first, and the individual can decide how much they want to trust you to give you more information. And oftentimes, ideally, you've developed a favorable rapport, and they'll open up more with a verbal discussion than simply a pen and paper, or however you present the questionnaires, the paperwork to fill out before the appointment. We can talk about the neurobiology of opioid withdrawal. It's characterized basically by the sympathetic arousal and the changes that oppose the acute effects of opioids. So you'll see a lot of noradrenergic hyperactivity with the typical experience of increased blood pressure, heart rate, respirations. Those symptoms can be reversed either by another dose of opioids or by clonidine. And there's an interesting role with GABA increasing when somebody's in withdrawal, and that can contribute to the dysphoria, depression, craving, and those are only reversed by opioids or buprenorphine or time, if somebody can maintain off opioids for long enough. So we can compare the pros and cons of the different medications. Again, there's not one medication that's right for everybody, but they all have their roles to play in different areas. Buprenorphine and methadone both offer relatively quick stabilization of withdrawal symptoms, as opposed to naltrexone, where you just have to get through the week or 10 days of withdrawal symptoms before starting the medication. Both methadone and buprenorphine can also treat concomitant pain syndromes. And again, the risk of overdose is increased in either of them if there is also use of benzodiazepines or alcohol.